Hello, my name is Kylie Jones, and I am passionate about improving mental health care in the hospital setting. Today, I'll share a story that encouraged me to learn more about mental health support in the hospital. I had a year or so ago a patient named, we'll call him John. He was a 65-year-old, and his life was turned upside down when he started experiencing extreme headaches. Vision got blurry. He was on his way to work when this happened, so he called his daughter, and though he was a really stubborn man, and he was hardworking and didn't want to miss his job, his daughter finally encouraged him and convinced him to make his way to the hospital where she had planned to meet him. Um, Luckily, he did make it to the hospital parking lot. However, he did not make it in. He ended up passing out and crashing into a pole in the parking lot, and luckily staff saw this happen and rushed out there to help him. So they quickly got him to a CT scanner and realized that he had experienced a stroke. Because of this stroke, he ended up having to be intubated for airway protection and ended up requiring a tracheostomy and a PEG tube placement eventually, as they were not able to wean him off of ventilation. And of course, he was not able to take in PO nutrition. By the time Mr. John came to my unit, I am on a progressive care unit, so we do take ventilators, stable vents, and by the time he got to us, he still had no function in his lower extremities, just from not using it. He had difficulty moving his upper extremities purposefully, and he also required constant mechanical ventilation. Because of this, he couldn't swallow, he couldn't talk, he failed his test with respiratory therapists to be passed for passing mirror valve on the ventilator, so he could not even speak to us and express his wishes to us. He could mouth words, but of course it was very difficult for us to make out everything he was trying to say, especially because he had some residual drooping in his face. Although it might have seemed like a victory that he lived through such a major health event, I could completely understand how easy it was for him to see this as a traumatic and life-altering event, and it ended up causing him a lot of psychological damage. And of course, everyone was extremely focused on getting him well physically, and through this, they ended up neglecting his mental health. Before he was independent, he was very active. He worked full time, and now he was dependent on others to bathe him, turn him, move his legs, brush his teeth, feed him, do every ADL that he previously was doing with ease. Seemed like for him, I'm sure, that every day he was getting weaker and weaker, and through that he was becoming more and more depressed and had less motivation to participate in physical therapy, speech therapy, everything, because he was just getting discouraged that he was, in his eyes, failing every day. Despite this serious decline in his function, doctors were still hopeful, based on some repeat CTs, that he had a chance of recovering some of his mobility, and he was going to get the chance to wean off the ventilator, and then of course eventually start being able to take PO nutrition and use his voice again eventually. Mr. John, however, was not quite as encouraged as we hoped he would be by the doctor's plans and hopes for him in the future. He started refusing physical therapy and just kept getting worse physically, and definitely worse mentally. But of course he was having a difficult time relaying about this because everybody couldn't understand everything he was saying. He just wished to be left alone. He eventually started expressing his wishes to die, but because we weren't able to perform a full psychiatric evaluation on him ourselves and determine his capacity because of his lack of a voice or a clear voice, we still had to provide him with all life-saving measures, including the ventilator, the PEG tube, despite his wishes ultimately to be more independent. Finally, one of the nurses on the floor had a great idea, was talking with the provider, and finally was able to convince the provider to put a consult in for psychiatry. And once psychiatry came and saw him, they did end up increasing his medications, his depression medications, because he was previously only on a very low dose medication. They did adjust those, and after a week or so, when that medication started to take full effect on his body, he was finally had some improvement in his mental health. He showed some desire to actually participate in all of the therapies. He became more encouraged to build strength in his arms so that he could do more for himself and eventually be able to feed himself and help with his baths and help with his turns. And through this experience with Mr. John, I saw this kind of glimmer of hope for other patients, as these are a frequent patient population on my floor, to encourage some more mental health building behaviors, even if we aren't able to get a psychiatrist there immediately. That nursing could step up and find ways to non-pharmacologically help out with the psychiatric needs of these patients. Many patients expressing depressive symptoms don't receive adequate mental health counseling in the hospital. In many cases, they go their entire hospitalization without being seen by a mental health professional. Some statistics that I found through the Agency for Healthcare Research and Quality showed that 25% of hospitalized patients have co-occurring mental health conditions, including depression, anxiety, substance use disorders, etc. Another source, Health Resources and Services Administrations, showed that 77% of counties in the United States face a shortage of psychiatric providers. In alignment with the Future of Nursing 2020 and 2023, my goal of improving patient access to mental health resources in the hospital directly correlates with recommendation 4 of the Future of Nursing 2020 to 2030. This recommendation is to ensure nurses are prepared to address mental health and wellness. This recommendation emphasizes training nurses to recognize and respond appropriately to mental health challenges. My call to action: while myself and other nurses may not have the power to increase amount of mental health doctors, we do have the power to effect change within the nursing community. We as nurses can seek out further education related to mental health and advocate for change within our workspaces. One way registered nurses can advance their knowledge of mental health is by joining the American Psychiatric Nurses Association, which will provide them with resources related to continuing education, certifications, and collaborative opportunities.